Leukemia. It's a cancer of the blood and bone marrow where blood cells are made. Often it begins silently, without noticeable symptoms. Imagine your bone marrow as a factory producing blood cells. Leukemia disrupts this, flooding the body with abnormal white blood cells. These rogue cells crowd out healthy ones, disrupting the bloodstream. Recognizing early symptoms can make all the difference in treatment. Leukemia is an umbrella term for several subtypes. It's classified into four main types: all, AML, CLL, and CML. Acute leukemias progress rapidly, while chronic ones are slower. Each type presents unique challenges and requires tailored treatments. For instance, all is common in children, while AML affects adults. Understanding these subtypes is crucial for accurate diagnosis and treatment. Recognizing leukemia's symptoms is crucial for timely diagnosis. Early detection improves treatment outcomes and survival chances. Treatments range from chemotherapy to stem cell transplantation. The effectiveness of these treatments hinges on early detection. Awareness and prompt medical attention can empower us in this fight. Imagine waking up feeling like you haven't slept in days. This fatigue, common in leukemia, is not average tiredness. Abnormal white blood cells crowd out healthy red ones, causing fatigue. Everyday tasks become exhausting, impacting quality of life. If you experience prolonged fatigue with other symptoms, consult a doctor. Early intervention is key to managing leukemia. Fever is often the body's defense against infection. In leukemia, fever can signal a weakened immune system. Leukemic cells disrupt the immune response, leading to persistent fever. This fever, often with chills and night sweats, can be a red flag. If you have persistent fever with other symptoms, seek medical attention. Early evaluation can guide appropriate treatment. Bruises are normal, but frequent bruising without injury can be a sign. In leukemia, low platelet count leads to easy bruising. Platelets help with blood clotting, and their reduction causes excessive bleeding. Bruises may appear in unusual locations and vary in size. If you notice unexplained bruising with other symptoms, consult a doctor. Early diagnosis is crucial for managing leukemia. The immune system protects us from harmful pathogens. In leukemia, white blood cells become compromised. This weakens the body's ability to fight infections. Leukemia patients are more susceptible to frequent and severe infections. Vigilance about infection signs is essential for timely treatment. Proactive steps can mitigate risks associated with a weakened immune system. Leukemia can lead to anemia, causing shortness of breath. Red blood cells transport oxygen, and their decline impacts daily life. Simple tasks become exhausting, leaving you breathless. Anemia in leukemia is serious and affects overall health. Recognizing symptoms and seeking prompt medical attention is crucial. Managing anemia improves well-being. Bone pain in leukemia is a persistent, deep ache. It arises from overcrowded leukemic cells in the bone marrow. This pain can disrupt sleep and daily activities. If you experience unexplained bone pain with other symptoms, consult a doctor. Early diagnosis and treatment are essential for managing pain. Addressing bone pain improves quality of life. Lymph nodes filter harmful substances and fight infections. In leukemia, swollen lymph nodes can indicate disease spread. Leukemic cells accumulate, causing persistent swelling. Swollen lymph nodes in leukemia are often tender and persistent. If you notice unusual lumps or swelling, consult a doctor. Early diagnosis is crucial for managing leukemia. Leukemia's overproduction of cells disrupts organ function. This can cause symptoms like enlarged liver or spleen and jaundice. Leukemia cells in the central nervous system cause neurological issues. Skin involvement can lead to rashes and lesions. These symptoms indicate the disease's spread. Early intervention is key to managing these complications.
Valentino to the OR, please. Dr. Valentino to the OR, please.
Section 5. The Unpredictable Course, Navigating the Unknown. It's important to remember that the progression of leukemia and the specific symptoms experienced can vary greatly from person to person, depending on factors such as the type of leukemia, the age and overall health of the individual, and the effectiveness of treatment. Some individuals may experience a rapid onset of severe symptoms, while others may have a more gradual progression with mild symptoms that develop slowly over time. This unpredictable nature of leukemia underscores the importance of regular medical checkups and seeking prompt medical attention for any unusual or persistent symptoms. Early detection and diagnosis are crucial for improving treatment outcomes and increasing the chances of survival. Navigating the unpredictable course of leukemia can be challenging, both physically and emotionally. It's essential to have a strong support system in place, including family, friends, and healthcare professionals who can provide guidance, encouragement, and compassionate care throughout the journey. Section 1. Acute lymphocytic leukemia, AL, a childhood foe. Acute lymphocytic leukemia, AL, casts a long shadow, particularly over the lives of children. It's the most common type of leukemia diagnosed in this age group, often appearing seemingly out of the blue and progressing rapidly. Imagine a child, full of life and energy one day, then struck down by persistent fatigue, unexplained bruising, and recurrent infections the next. This sudden shift can be the first sign that all has taken hold. In all, the bone marrow, the body's blood cell factory, becomes overrun with immature white blood cells called lymphoblasts. These dysfunctional cells, unable to mature into functional immune cells, crowd out healthy blood cells, leading to a cascade of symptoms. Parents might notice their child becoming increasingly pale, complaining of bone and joint pain, or developing swollen lymph nodes, particularly in the neck, armpits, or groin. These symptoms, often mistaken for common childhood ailments, can be easily overlooked, making early detection challenging. One of the hallmarks of all is its tendency to spread to the central nervous system, the body's command center. This can lead to neurological symptoms like headaches, vomiting, blurred vision, seizures, or even changes in personality or behavior. These neurological manifestations underscore the importance of prompt diagnosis and treatment to prevent potentially life-threatening complications. Acute myeloid leukemia, or AML, often emerges silently, lurking in the shadows until it unleashes a torrent of symptoms. This aggressive form of leukemia, more common in adults than children, affects the myeloid cell line, responsible for producing red blood cells, white blood cells, and platelets. In AML, the bone marrow becomes inundated with immature myeloid cells called myeloblasts. These dysfunctional cells, unable to mature into functioning blood cells, crowd out healthy blood cell production, leading to a rapid decline in red blood cells, white blood cells, and platelets. This deficiency in all three blood cell types, known as pancytopenia, results in a constellation of symptoms, including fatigue, shortness of breath, pale skin, easy bruising or bleeding, and increased susceptibility to infections. The severity of these symptoms can vary depending on the extent of bone marrow involvement and the overall health of the individual. One of the insidious aspects of AML is its ability to spread to other organs, including the liver, spleen, lymph nodes, central nervous system, and skin. This spread can lead to a range of additional symptoms, such as abdominal pain or swelling, bone pain, headaches, seizures, or skin lesions. The rapid progression of AML necessitates prompt diagnosis and aggressive treatment. Early detection and intervention are crucial for improving treatment outcomes and increasing the chances of survival. Chronic lymphocytic leukemia, or CLL, often smolders quietly for years, its symptoms barely noticeable in the early stages. This slow-growing leukemia, primarily affecting older adults, involves the overproduction of mature, but still abnormal lymphocytes, a type of white blood cell involved in immune responses. Imagine a garden slowly being overtaken by a persistent weed. The weed may not be immediately noticeable, but over time it crowds out the desired plants, disrupting the garden's balance. Similarly, in CLL, the abnormal lymphocytes gradually accumulate in the bone marrow, blood, lymph nodes, and other organs, interfering with the normal production and function of healthy blood cells. Early on, individuals with CLL may experience no symptoms at all. As the disease progresses, however, they may develop fatigue, weakness, swollen lymph nodes, frequent infections, weight loss, or night sweats. These symptoms are often subtle and easily attributed to other age-related conditions, making early detection challenging. Unlike acute leukemias, which require immediate treatment, CLL often follows a more indolent course, with many individuals living for years without experiencing significant symptoms or requiring treatment. However, as the disease progresses, it can lead to complications such as anemia, infections, and an increased risk of developing other cancers. Chronic myeloid leukemia, or CML, carries a unique genetic hallmark, the Philadelphia chromosome. This abnormal chromosome, formed by a translocation between chromosomes 9 and 22, leads to the production of an abnormal protein called BCR-ABL tyrosine kinase, which drives the uncontrolled growth of myeloid cells. Imagine a factory with a faulty switch stuck in the on position, causing it to churn out products non-stop. This overproduction disrupts the factory's delicate balance and can lead to problems. Similarly, in CML, the BCR-ABL protein acts like a faulty switch, driving the overproduction of myeloid cells and disrupting the normal balance of blood cells in the body. CML typically progresses through three distinct phases: the chronic phase, the accelerated phase, and the blast crisis phase. In the chronic phase, which can last for several years, individuals may experience few or no symptoms. As the disease progresses to the accelerated phase and blast crisis phase, symptoms become more pronounced and can include fatigue, weight loss, night sweats, abdominal pain or swelling, bone pain, and easy bruising or bleeding. The discovery of the Philadelphia chromosome and the development of targeted therapies that specifically inhibit the BCR-ABL protein have revolutionized the treatment of CML, significantly improving outcomes for individuals with this disease. Treating leukemia is not a one-size-fits-all approach. It requires a tailored strategy, carefully crafted based on the specific type of leukemia, the stage of the disease, the individual's overall health, and their personal preferences. Like a tailor meticulously measuring and cutting fabric to create a perfectly fitted garment, oncologists carefully consider various factors to develop a treatment plan that best suits each patient's unique needs. Chemotherapy, a cornerstone of leukemia treatment, uses powerful drugs to kill cancer cells or stop their growth. It can be administered intravenously, orally, or directly into the spinal fluid, depending on the specific type of leukemia and the extent of the disease. Radiation therapy, which uses high-energy rays to damage and destroy cancer cells, may also be used to treat leukemia, either alone or in combination with chemotherapy. It can be delivered externally, using a machine outside the body, or internally, by placing radioactive material directly into or near the tumor. For certain types of leukemia, such as chronic myeloid leukemia, targeted therapies that specifically target the abnormal protein driving the disease have proven highly effective in controlling the disease and improving long-term outcomes. These targeted therapies work by blocking the signals that tell the cancer cells to grow and divide, effectively putting the brakes on the disease's progression. The landscape of leukemia treatment is constantly evolving, with new discoveries and advancements offering hope for improved outcomes and a better quality of life for individuals facing this challenging disease. Imagine a research laboratory buzzing with activity, scientists diligently working to unravel the complexities of leukemia and develop innovative treatments that target the disease with greater precision and fewer side effects. Stem cell transplantation, a procedure that replaces damaged bone marrow with healthy stem cells, has emerged as a potentially curative treatment option for certain types of leukemia. This procedure offers the hope of a second chance at life for individuals whose leukemia has not responded to other treatments or who have relapsed after initially successful treatment. Immunotherapy, which harnesses the power of the body's own immune system to fight cancer, is another promising area of research in leukemia treatment. Immunotherapy drugs work by boosting the immune system's ability to recognize and destroy cancer cells, offering a targeted approach that minimizes damage to healthy cells. CAR T-cell therapy, a type of immunotherapy that involves genetically modifying a patient's own immune cells to target and destroy cancer cells, has shown remarkable success in treating certain types of leukemia, particularly in children and young adults. This groundbreaking therapy offers new hope for individuals with relapsed or refractory leukemia who have exhausted other treatment options. Throughout this exploration of leukemia, we've seen how it disrupts blood cell production and impacts health. Early detection is paramount. It stands as our first line of defense. Timely diagnosis allows for effective treatment, offering hope and a fighting chance.
Valentino to the OR, please. Dr. Valentino to the OR, please.
Recognizing the signs of leukemia is just the beginning. Seek timely medical attention and build a strong support system. Like a ship in a storm, rely on experts and loved ones. Consult doctors if you notice persistent fatigue, bruising, or other symptoms. Remember, you don't have to face this journey alone. Reach out to family, friends, and support groups for help. A leukemia diagnosis can feel daunting, but advancements in treatment offer new hope for better outcomes and quality of life. Researchers and healthcare professionals have transformed leukemia treatment. Chemotherapy now targets cancer cells more precisely, reducing side effects. Radiation therapy delivers higher doses to tumors while sparing healthy tissues. Targeted therapies block abnormal proteins, revolutionizing treatment for certain leukemias. These therapies minimize damage to healthy cells. Stem cell transplantation offers a potential cure for some leukemia patients. Immunotherapy harnesses the immune system to fight leukemia, showing success in children and young adults. These advancements are a testament to the dedication of researchers, clinicians, and patients. They offer a beacon of hope, turning leukemia into a manageable condition. Living with leukemia is a journey of resilience, a testament to the strength of the human spirit. It's about adapting to a new normal and embracing moments of joy and gratitude. Imagine a tree weathering a storm, its branches bending but not breaking. Similarly, individuals with leukemia draw strength from within and from loved ones. Prioritize self-care, maintain a healthy lifestyle, and seek emotional support. Engage in activities that bring joy and foster hope. Remember, a leukemia diagnosis does not define you. It's just one chapter in your life story, filled with opportunities for growth and connection. Embrace support, seek solace in activities, and maintain hope for the future. The fight against leukemia is a marathon, and every step forward is a victory. Keep moving forward, embrace hope, and remember, you are not alone.